Actually, I can't tell that they're not my real teeth.
It was amazing.
Been really, I mean, it's been like night and day, you know, difference. I mean, it really has.
Today we're talking about dental implants, and if you want to know what kind of night and day difference they can make for you, then stay tuned.
Missing teeth? Tired of dentures? We can help.
This week we have a whole new story to tell. We've got a documentary style case that we've followed over the last few months on a patient that drove in from the state of New York to totally get things redone. You know, Anthony was at a place in his life where he wanted to change, he needed to change, and I was really excited to be able to pull the trademark and Huntline together and pool our resources and pull off a treatment plan that's going to give him a result that actually feels like teeth and not a denture, something he can be proud of and something that'll hopefully change his life. You know, when Anthony got to town, we talked it over, showed him what we were talking about, and once he gave us the green light, we were excited to get off to impressions and get going.
Right out of high school, I mean, I had good teeth. I wasn't really a drinker then. You know, I didn't drink alcohol, and I decided to join the Army to help pay for college. So when I was in the Army, it was either you were a barracks rat or you went out and hung out with everybody else. And I did not want to be a barracks rat. So I went out and hung out, and that's when I started drinking. And I can't say I was an alcoholic because I was able to quit without actually going to rehab. I quit cold turkey. You know, I didn't really get the withdrawals, but I was an everyday drinker. I drank on average a 12-pack a day, a lot more on the weekends. But my daughter had just turned a couple months old, and I knew I got in trouble with the law. I got DWI, and I knew I had to change my life. So on 7/10/10, I quit drinking cold turkey. And I can't say cold turkey because I switched to soda. And I drank as much soda as I did alcohol. And that was roughly 12 sodas a day, and probably more than that. And after about 6 years of that, I noticed my teeth getting really brittle. Some of them started falling out, and I didn't really keep up with the dentist. I'm embarrassed by my smile is probably the #1 driving factor, you know. I don't like myself, and it's caused me like emotional distress, pretty much. You know, my self-esteem's gone way down. And I don't feel good about myself. I don't like to smile in front of people. I always find myself covering my mouth. You know, whenever somebody says something funny, so I need to change to bring my smile back where I can feel comfortable in my own skin again. That's what drives me. It's what drove me here, to deal with the pain and to deal with my anxiety, because I'm really anxious about having dental work done. I've had a bad experience with a dentist before, and I got to conquer that fear today in a couple hours. Yes, I am.
For just a second, it's going to get started on your impressions, and then I'll give you your paperwork back afterwards, and you can go ahead and start.
Yeah, real on that. How long did it take? Yeah, I missed you when you came up to me.
like that when it doesn't taste good. You're like, get this out of my mouth. I just want to try this tray in to see if it's going to be my right size. Okay. Okay, so try to keep it long this one.
After Sam has completed surgery on a pre-surgical model, that model is then scanned into software. At this point, the digital model is then ready for me to place teeth, design, and then get Sam's approval. After this, we are ready to mill.
An immediate roundhouse is really an innovative design in dentistry because it forces the removable side of a dental lab to communicate to the fixed side of a dental lab. And removable things are coming out, and fixed they're cemented on. And we had to bring our teams together to really communicate throughout the process of manufacturing this prosthetic. This surgery was done on a Friday night, so we had to go over everybody's roles and we were ready to go. This is kind of a all hands on deck. When I start hollering out numbers, I'll say 2018, 2015, 2515. But this is maxillary, this is mandibular, this is what I'm proposing in these sites. And I'll be yelling out and one of the assistants will be grabbing them. You guys will be helping hand them off. As far as if I change stuff, the 4 and 13 sites, I'm thinking I'll do conventional implants, but I'm not sure what size. So I have all the sizes that I might choose laid out right here.
Number 2's out of the mill. It's done and it's...
Did it mill all the way?
Yep, perfect.
Oh, good.
Let's go ahead and drill out 3 8 and 9. And these teeth I want you to treat,
Kind of hollow them out a little bit.
hollow them out a little bit, but not so much towards the buckle. And then I'm gonna do minis here and here. I think I'm just gonna go with those 8 on the lower right now.
After James finished milling the prosthesis, I took it and milled out the implant sites by hand.
Put a little line on those. Let's hold off on those. Great. Okay. All right. Cool.
The last time I assisted Dr. Sam was a couple years ago on a full arch case, and I'm really excited to get back into this one because now we've got 2 full arch cases, full mouth extractions, and with new prosthetics that I've never done before, so I'm ready to get going.
It's a lot of work. He's going to be doing a lot of work in my mouth. And like I said, I'm anxious, nervous, but I'm ready. It's going to be a life-changing experience for me. Something that I positively, absolutely need in my life. I'm excited to smile again. I'm excited to just be myself and be able to talk to people, be able to eat an apple, to be able to bite down into a sandwich and not worry about my other front tooth breaking out.
Yeah, there you go. That's a good thing. It wasn't that drafty little bit you're doing.
I tend to make a sulcular incision. I used to just take a periosteal and reflect, but that kind of tears it. I find that you get a better cut through your gingival fibers, and it allows your forceps to grab that root just another millimeter down or so. I feel like I break less teeth because my forceps slips past the decay a little bit. You know, the whole goal on this surgery is atraumatic extractions because we're not doing alveoplasty. That must be from New York.
Throughout 20 years in healthcare, I've seen countless medical surgeries. This was the first oral surgery that I've been part of.
Yeah, it was really cool to see that we could implement the back part of the lab to the clinic aspect and see the way that we can merge it together and create one final product.
That's a real woman. Definitely. Yeah. It's good. You're gonna be good for a while. We got those pictures. Pretty responsive, isn't it?
With Anthony being here for just a short time, it was really amazing to see the whole team come together and get the job accomplished. The lab came over and everybody was on the same page from start to finish.
Man, the whole team came together. It took about 3 hours. We're all a little tired, but we're super excited for the initial result and to watch it heal over the next weeks and months. Let's hear from some of our other happy patients.
I was having a lot of trouble chewing, and now I can eat anything.
Never had any pain.
The pain has been a lot less than what I first anticipated. I can't tell they're there.
So far I've had no issues. I didn't want to have all the hassle. They fit tight. I have a lot more bite force than I had before.
I like my T-bone steak and I like my strip sirloin too. It was very changing for me, impressed with the way they worked.
Oh my gosh. That looks so much better than my real teeth.
I was afraid of the pain. I didn't feel any of the work that they did, and it was amazing.
It's been like night and day, you know, difference. I mean, it really has. I mean, if anybody was going to do it, I mean, this is what they should do, not mess around and do anything else, you know. Go with the implants.
Okay, we're going to catch back up with Anthony here. We're in day 2. We're about 16 hours post-op, and he's going to give us a little reaction. Research shows 12 hours post-op is generally the peak of pain after a tooth extraction surgery. So let's get with him and see where he's at.
Well, it's day 1 of the healing process, and I can already notice a lot of a difference. I mean, it's still getting kind of hard to talk, but the pain is nowhere near what I thought it was going to be. I thought right now I'd be laid right out on not be able to move or anything. It was just a fear I had in my head. The talking is probably going to take a couple weeks to get used to. Still swollen in there, I can tell. The most pain I actually got is a headache, which I think is from the lack of caffeine, because I've been just drinking water and I'm used to a couple coffees and, you know, soda here or there. I thought it was going to be a lot worse though. I'm really surprised and just ready to go do something today or something. I mean, I don't feel too held back right now. No real pain, it just feels weird right now. And I got a headache, but honestly, where everything happened, there's no pain. It's crazy.
So, to give you a little background here, Anthony is Garrett's brother. And if you guys don't know Garrett, he's been on the Hunting Show a little bit. And he's the guy that has really been filming Huntline TV predominantly and producing it from a raw footage standpoint for the last 3 or 4 years. He works at the office full-time now, and he's filmed and edited this whole surgery. And, you know, so I have a little bit of access to this patient on the weekend. You know, if Anthony's not having any pain and he's wanting to do something, I can put him to work.
What are we doing out here? Just turn around, I'm on camera. We're out here helping Sam do some food plotting.
Day 3.
Day 3.
Had surgery on Friday. It's now Monday.
Yep.
Memorial Day.
Yep.
How you feeling?
The roof of my mouth's a little tender, but everything else feels great. I feel like a new man.
The nose of this up here because we might go over there and nose of this that. No, we're about to go do our, what would it be, 4-day post-op, and we'll take a look at his tissue, take a look at the photos. So far his symptoms have been really good. A little pressure on day after the surgery, but no real specific acute pain or anything like that, just some soreness around the edges. So he's been brushing it. Let's go see what it looks like. How are we?
Good, how are you?
Good, good. Still doing good?
Yeah.
A little bit of trimming we're gonna do to make it a little bit, some of the edges are, man, the tissue's just, I'm really happy with that. Yeah, those edges you were telling me about, that's exactly what you're feeling. Little kind of rough edges here and there. Great job, bud, great job. I will say they're one of the best patients.
For surgery?
Oh yeah, he was really, really good.
That's awesome.
It was tough. I mean, we didn't have great immediate sites and we were losing stability on implants and kept having to change our plan up, but we got him in there and he hung in there with us.
That's good.
There's a little spot up front there. Open, big. Little spot right there. Okay. Open. Back down.
You're like the $6 million man. All right, bud. And I'm going to put these both on the same side. I want you to tap, tap for me. And now bite and hold it. And open. And now tap, tap. Now bite and hold it. And open.
Well, it's day 5. I made the trip out from New York. It's about 900 miles, about 15 hours. And I'm getting ready to get back on the road. Got her. Not too many people knew about my teeth and how bad they were. So nobody really noticed until I showed them, which was a real eye-opening experience for a lot of people. They're like, man, you hid that well. They had no clue. It's one less thing I have to be embarrassed about. It's changed my life, pretty much.
I've worked with and around Anthony for just about 2 years now. We used to be on the same crew on the inliner. We're both mechanics. When I first met him, he was real standoffish about his mouth. He'd always have something in front of his face, wouldn't really smile too big. He was always a little timid about the way his teeth appeared.
We both are mechanics. We work in the sand room as foundry maintenance. He didn't really smile that much, didn't really talk. Kind of hide his teeth there.
This was my major insecurity. You know, I knew my teeth were going bad for 3 or 4 years before it finally got to the breaking point for me. And since the procedure, my confidence has gone up 100%.
Yeah, he's a lot more happier, it seems. I'll tell you, it looked good.
As soon as he came back, it was like a new man, basically. He was smiling ear to ear. I got better teeth than you now. And it definitely improved his life, I do believe.
It's a whole new experience. Everything seems to taste the same. I haven't noticed any difference in taste or anything. I have all my taste buds still.
I wanted him to obviously get it fixed. And I wanted him to feel comfortable with him smiling and stuff like that. He's a lot more happier now that he got everything fixed, and he can actually, like, he smiles now and stuff like that. And he doesn't try to cover it all up.
Because he kept his mouth closed, so nobody could see him, which is kind of what I do. Just something you pick up over time. You don't smile a lot, and that's the way it goes. Yeah, I don't know. There's little stuff that you live with, and you don't realize it until something changes. But yeah, I don't know. I guess he seems more open, talks a little more. Yeah, doesn't turn away from you while he's talking. Anthony, fortunately, will never have to experience a denture. But he's happy and I'm happy for him. I think it's great.
Before, when I'd trim my mustache, I'd keep it the same length my whole beard, you know, and I'd kind of go a little bit longer to cover it and block anybody from possibly seeing my teeth. But now I actually trim my mustache lower than I do down here. Super exciting thing I got done. I mean, it changed my life. And right now, I'm not released to chew. I'm planning on going back out to see Sam around Christmas time, which will be roughly 6.5 months. I'm gonna go out and get my final roundhouses in there. They'll be made out of a different material. They're glass. They're actually zirconia. So I'm pretty excited to get that done and to actually go back out to Missouri.
You know, this is the first case that we've ever documented like this, and I've got to tell you, it's hundreds in the making. Every time I wish we could document them all this way and take them out there. And we're actually going to move to where we're bringing our viewers in to seeing what we're accomplishing for patients on a more routine and a more frequent basis and a more almost semi-live basis. So you have to check out our video blog in the future. But you know, to hear everyone's reaction, to see the result happening, and to give someone a product that is not a denture, that gives them the confidence to smile and change their life. I couldn't be more proud of what we're doing here at Huntline. Trademark Dental Labs, Mark and I have merged together on that, and you know, to pull those kind of teams together, you know, there's 25 people involved in this, and to pull that kind of team together and be able to pull the technology, the clinical skill, the surgical skill, the prosthetic skill, the manufacturing of the prosthetics. I just couldn't be more proud of what we're doing for patients. And I want you guys to give us a call. I guarantee you we can help you.
The only real person that knew how bad my teeth were was me, because I hid it. I was embarrassed by it. And I've noticed my confidence has gone up. I'm smiling a lot more. I'm trying to smile as much as I can to show these teeth right off. I want everybody to know, hey, look at me. I mean, I know I'm not perfect, but my smile's pretty close to it now.